I think that the most important thing for the patient and family to understand is that the more information they can gather from the medical team about the condition they have, the better. So getting a broad knowledge of what the medical profession, nurses and doctors think that they have, and then to whatever degree they can, understanding for themselves as well, given good access on the internet to NIH, National Institutes of Health websites and so forth, to make sure that they get their own personal education in what they have, because it's that will play a role in how they are treated and how they themselves make decisions with regards to care. I think that it actually is sort of similar in terms of information, which is that the physician themselves may be an expert, which is fantastic, so they know the field very, very well. The physician that isn't located in a center where, let's say, vaccines and immunotherapy for cancer are being regularly used, must inform themselves and educate themselves about those opportunities so that they can offer the most up-to-date treatments for their patients, and also work out how they could access that care for that specific patient if they are in a hospital outside of the kind of centers where the immunotherapy and the vaccines are delivered. And I can give you like a personal example of that, because I do get physicians from hospitals both in Massachusetts and outside of Massachusetts who say, I have a patient with this condition. How would this, with the current vaccines and immunotherapies, how would you suggest that I approach this for my patient, or who should I talk to in your center or beyond to help? And I'm always like more than happy to either try and answer myself or connect them directly with someone who can tell them what that information, because keeping up to date across all of the fields is very difficult. So sourcing information is extremely important for patient care. The culture of Mass General is to allow independent thought and out-of-the-box thinking to develop new treatments, vaccines for human disease, focused on delivering that as effectively and safely as possible to patients. So the actual ethos of the institution is extremely dynamic and extremely open to new ideas. And that's important when a field is moving so rapidly. In order to keep up that field, you have to have that type of dynamism in thinking to be delivering and researching the latest things and learning from what the most recent science that is being done is actually reporting.